Hey guys, I'll be talking about cancer today. Today we'll be talking about what causes breast cancer. How the hell does breast cancer start? What causes? If someone very close to you or you yourself have been diagnosed with cancer, there might be a lot of thoughts in your head thinking, why is this happening to me? Why do I have cancer? What happened? What is the cause? A lot of people have heard like, oh, maybe it's genetic, maybe it's in family, but there are actually other factors that causes breast cancer because only 10% of cancer cases are as a result of family history. Why some factors can be prevented, such as lack of exercise, then some cannot be. You can't possibly just change your sex. Okay, I know there's transgender, but I'm not very sure if that will work. When you change your sex, does it affect your the rate at which you have breast cancer? I'm really not sure about that. So you can't change things like your age because the older you get, you realize that there's an high tendency of getting cancer as a result of some factors and also maybe family history. So I'm going to be talking about when I look at this direction, I'm looking at my laptop. Yeah. So I'm going to be talking about six factors that are risk consideration. So what are the risk considerations that are really unavoidable for cancer? The first one is being female. Girl, that you are a female, you have the higher percentage of getting breast cancer than male. I mean, Living Beyond Cancer published an update on their website saying that 1 in 8 US women is estimated to have cancer and 1 in 833 male. Before you get one male, before you get one male cancer patient, you must have gotten like I just can't do the calculations right now. Maybe like over 100 females. So the fact that you're a female expose you to an higher chances of having breast cancer. And then the second one is growing old. The older you get, the higher the risk of being a cancer patient. So age do affect this thing. And I really don't know why, but I would say probably because of diet, things you've exposed your health to, and then they accumulate over the years. And then you won't kind of have cancer at a later age compared to when you're still very young. Then the third one is family breast cancer history. I learned this thing I'm not sure if it's really secondary school because I know I have known it since a very long time. I have to look at this because I don't have it right here. They call them the Ashkenazi. I hope I'm pronouncing it well, really. The Ashkenazi family. I think no, I know they are Jewish, family. So if you have a descendant, if you're a descendant from the Jew, you're most likely you have higher chance of being exposed to cancer because of heredity. Do you understand? So if say your mom or your grandmom or your aunt or a relative has been diagnosed with cancer, then you want to be careful about the risk, which I'll talk about after this, that could expose you to being, a cancer patient. Then the fourth one is previous chest radiation treatment. When you expose your body to a lot of radiation, you must have heard this thing that the X-ray thing kind of kills or damages the cells in your chest when it's being done, especially various times. So when you expose yourself to a lot of radiation around your chest area, then there is likelihood that some cells become damaged and then they begin to replicate uncontrollably. Now I lost count, but the next one is menopause as an older age. There's a certain age at which women are meant to reach menopause, but when you don't get it at that particular age and you're getting menopause at 70, then you have a higher chance of getting, having cancer. But at the same time, 70 years is a long time. I'm not saying it's a good time to die. I'm just saying 70 years is pretty a long time to live. So the next one is, I actually need to call this. The next one is diethyl stilbestrol exposure. So this is diethyl stilbestrol exposure. It is called DES. And then it says here that it's a drug used in 1940s to early 1970s to lower the risk of miscarriage. So women, women don't want to undergo miscarriage. Do you understand? I would rather use a medication that would lower the rate at which I would have miscarriage, right? But that drug, DES, I'm kind of write it because I really can't pronounce it well. Kind of it exposes you to, higher chance of being a cancer patient. So that about that, the next thing we'll be talking about is the risk consideration that you can manage. The previous ones that I've listed, you most likely cannot prevent them. You can't prevent yourself from being a female. You can't choose the family in which you're giving birth through. Yeah. But there are ones you can manage, and I have four of them in total. The first one is inadequate exercise. Women exercise. I mean, I don't mean you should exercise just because you want to lose weight, but just exercise your body. Fitness is a really big thing. I don't practice it always, but I would just advise you should. So, okay, I'm talking to myself right now. Exercise enough. You should be able to carry your body. So, and the second one is weight gain after menopause. So, for older women that have reached menopausal stage, you want to reduce, probably the amount of cholesterol you eat that would lead to, you know, higher increase of weight. So you do not want to have an increased weight after menopausal stage because that way you are preventing yourself from having a high chance of being a cancer patient. Does that make sense? So the third one is alcohol consumption. See, there are a lot of research that have linked alcohol intake to cancer. So if you're an alcoholic, I mean, you just enjoy drinking alcohol. You might want to limit that because of your health. If you don't like cancer and then you love alcohol, then you might want to slow down the pace at which you drink alcohol or take alcohol on a daily basis because of your health, especially if you're a woman. The last one is taking some kind of hormone replacement after menopause. I mean, you've already reached menopause. There's no point taking such, drugs or medication. Just reduce the intake of the hormone replacement medications you take for your health's sake. So, the next thing I'll talk about is risk mitigation. That's where the title of this video actually came from. What causes breast cancer? Risk mitigation. So, how do I reduce my risk of actually getting being a cancer patient? So the first thing you want to do is to limit your alcohol consumption. So you don't have to drink alcohol on a daily basis, especially if you're alone. I know you might say, oh, maybe you have a lot of things going through your head and then you want to drink it off. Easy. Reduce it, right? Then the next one is routine exercise. Ensure you exercise on a routine basis. If you have to subscribe to a gym, you don't even need to subscribe because your apartment probably have a gym. So you want to just go in there, gym your body out. I'm not saying you should take it as a daily business. And then I find you the gym 8 to 4, Monday to Friday. You're gonna go broke. So you go for routine exercise. And then the third one will be maintaining healthy weight, which actually, especially after menopause, which actually come from routine exercise. The fourth one I'll talk about is reducing the use of hormone replacements. You realize that these are just reverse of the four previous risks that can be controlled that I mentioned earlier. For the other ones, you really cannot change those ones. The fifth one is if you have children, and if you're a mother, you are advised to actually breastfeed your kid. I know some women do not like breastfeeding and they want just to 3 months. After 3 months, then the baby can eat ramen. But as much as possible, if you can breastfeed for 1 year, it helps reduces the risk at which you become a cancer patient. Then the last one I have here is to go for regular. You should go for regular screening, breast screening at your hospital. I mean, you do not need to wait for when you start having pain in your breast before you go for a routine breast screening. Some cancer types are symptomless. Like you won't get the signs. And I'm using the words interchangeably now because there's difference between signs and symptoms. So we'll talk about that in my next video. But you want to ensure that you go for breast screening on a regular basis. When I mean regular, it really do not mean every month, or have a routine to check your health. Alright? So the last part of this video would be drug used to lower breast cancer risk. So there are some drugs that you can use to lower breast cancer risk. I am not an oncologist. I am a master's student. Everything I share in the video is basic Google knowledge. So I'm not saying you should finish watching this video and then you go to the nearest pharmacy to get the drug. I'm not gonna be held responsible. Anyways, there are preventive medicines that you can use, especially for females. And I have three of these drugs. I might need to carry my laptop again because I really cannot pronounce these things. So the first one is tamoxifen. Tamoxifen. I'm going to write it here. And then it blocks estrogen in breast cancer, so it is useful in lowering breast cancer risk. And the second one is raloxifen. Raloxifen. The spelling right there. That one also blocks estrogen in the breast, hence lowering the risk at which you become a cancer patient. The third one is aromatase inhibitors. I feel like these are most likely the real name and not the brand name. If you get to a pharmacist store now and ask for tamoxifen, you most likely wouldn't get. I I would assume because they don't sound like brand name. Do you understand what I'm saying? So the last one is aromatase inhibitors. Said the lower estrogen level in women who have already gone through menopausal stage. So if you're still like in pre-menopausal stage of your life, then you're not advised to use aromatase inhibitors. If you find this video helpful or insightful, then you should share it to other people to read, to watch. The main reason for doing this is so that you can become accustomed with the science world, cancer specifically, and also your body. This way, you are aware of what is going on in your breast, and you are saving a life, if not yourself. Thank you for sticking to the end. Then I'll see you in my next video. Bye.